whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Leaders in Healthcare. I'm Dr. Jordan Vollrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about all things healthcare. Join us as we speak to innovators, industry leaders, and the people working to drive the healthcare system forward.
All right, so today we are doing another live episode of Leaders in Healthcare, and I'm joined by Cara, Ferreira, and Jennifer Campbell, two of the FMF staff. We've got the coordinator and lead for the exhibit side of things, as well as the CFPC's director for events. Thanks for coming and talking about the FMF event today. I'm excited to learn a little bit more about the behind the scenes and what exactly goes on to putting the biggest medical CME event in Canada up every year.
Thank you for having us.
Thanks, Jordan. Glad to be here.
Awesome. So how big is the team? How many people actually work on putting this whole event together every year?
We have 10 staff in our events team and many others across the college that help, as well as our FMF committee that helps to organize and put this all together.
Very cool. And what's kind of the distribution? Is there like subgroups or divisions within the team, or what are the different departments that actually go into the planning?
Sure, I can take that one. I think that, the Scientific Planning Committee, of course, they select all of the educational content every year. And then our job as our events team is to operationalize it all. So we have people who lead the exhibits hall, people who handle our registration, our FMF app, and then all of our other fun things that happen like food and beverage, entertainment, getting everybody in and out of the building. And it takes a big group effort to make it happen.
Awesome. And how long has the event been around for now? What's the original year that you guys put this on?
I think it's been about 16, 17 years now. We started out as sort of a hotel-based event, and then it's grown and grown. So now we're in Canada's largest convention centers.
And then I heard a little bit earlier, just in terms of the timing, it sounds like it's not like this one ends and then you guys begin planning the next one. It sounds like you guys are already started on the 2025 event. And how long in advance do you actually start thinking ahead and prepping for the next year's event?
So we start planning about 2 to 3 years in advance for each event. And then it takes us a while to shut it all down. So
yeah. How long does it take to clean everything up afterwards?
It's a few months after.
Oh, really?
Yeah. So we're already planning the next one while we're shutting down the current one.
Okay. And what are like the very first things you have to think about when coordinating and planning such an event?
I mean, we start sort of with the whole strategic planning exercise, of course, making sure we're meeting all the goals of what our physicians need in terms of education, even inspiration. And then we go out to request proposals from kind of Canada's largest convention centers and the most desirable destinations that will accommodate us. And then we also need, of course, hotels within a reasonable proximity. We'd like to get a nice, safe walking distance, and we usually need to house about 3,000 plus people, so you have to have both the convention and the hotels to support it.
Okay, and when are you coming to Calgary is my next question. What are you waiting for?
We actually have a proposal for Calgary now.
Okay.
Our FMF manager, Cheryl, who's handling some business upstairs right now, she was actually at the grand opening of the new BMO Center there. So there is just now a facility that could potentially host us. So we're looking at it.
I can't wait to come when there's no jet lag or time zone change. That would be wonderful. How do you actually get everybody here? What goes into the promotion and I guess the marketing for the event? Again, you get like thousands and thousands of people every year. What's the secret?
I don't know. I'm not sure there's a whole secret. It's just a big multimedia campaign. We use, of course, emails, social media, direct reach outs to our members. But then we also work with our CFP journal as well as CMAJ and some other publications to advertise in and just get the word out. And of course, the lovely word of mouth from all of our committee members and our dedicated people that come every year just promoting what a great experience it is.
Well, I could imagine, yeah. And then do you find that does it depend at all on where or proximity with other events? Like St. Paul's is coming up in a few weeks as well. Do people tend to do multiple different events?
I think people have to choose a little bit. I mean, sometimes we conflict with St. Paul's, which is an amazing conference, or with the NAPCREG, which a lot of our researchers attend. I mean, I do think there's maybe a bit of a way to kind of collaborate with some of these. We do try to avoid competing directly with the dates of some of our major other kind of call them partner events. But yeah, I think it's pretty hard for a physician to get, 3 weeks off. So
Yeah.
they need to pick and choose which conference they'll attend each year.
Yeah, no doubt. No rest for the wicked. Do you guys get any time off after this wraps up on the weekend, or does it immediately just go into prep and getting ready for 2025 then?
Yeah, there's no time off actually. No, we do a ton of data analysis after the fact, and all the reporting that immediately happens after FMF, along with reconciling the bills and details. And then at the same time, we're launching our call for abstracts in mid-December, as well as our exhibit hall. So it doesn't stop.
You jump right back into
Right
it
back in.
immediately.
Yeah.
Okay. How do you choose the city? How does that conversation typically go?
Yeah, well, we touched on that a little bit, but we do need, so this exhibit hall, spatial awareness sometimes is questionable, but this is about 100,000 square feet. We also need between 25,000 and 50,000 square feet for our keynote theater upstairs. And then it ends up being about 25 to 30 additional rooms for all the other concurrent sessions we have, meetings and that take place. And then again, about 3,000 hotels within walking distance. So for Calgary, for example, they're looking at putting a few new hotels right there in the Stampede Grounds area, which will be great. So we're kind of hoping to find that there's some really great hotels going in, and then planning a future visit to Calgary around that.
Okay. How many people could attend? Like, is there a theoretical maximum capacity for the venue?
We typically get about 5,000, but I think that we could certainly do more. I mean, it just, obviously you have to have enough room for everybody to be able to attend a session. So it's just about having more and more sessions. So you do have to kind of build accordingly based on how many people are coming.
And like in Canada, as far as events go, is that kind of the upper echelon? Like if it doubled or tripled in size over the coming years, would you just be completely hamstrung by available venue capacity? Or is there other places you could do it at?
We would definitely have to start looking at farther away hotels, and we would just have to design the program a bit differently. In terms of seating people concurrently at sessions, we are kind of maxed out where we are at right now. But if we know it's coming, if we build slow and steady, then we can continue to increase and maybe direct traffic in different ways so we can accommodate more people.
Gotcha. Okay. Awesome. Well, I'm looking forward to seeing things grow over the years. What's the budget for the event? I got to know. How much does this actually cost to put the whole event on?
We spend about $3 million on an event this size.
What's the number one line item on there?
Number one.
I'm going to say probably our bill from the Vancouver Convention Center.
What does that cost per day? Am I allowed to ask this?
I mean, there's rent, and then obviously food and beverage and additional services. There's rigging and electrical and all of these different things. So it's about $1 million all in all for
Holy
something
smokes.
like that. Yeah,
Okay.
it's quite a lot to rent the largest convention centers in the city.
Does it wind up being like a revenue generator for the CFPC, or does it wind up being, you guys are subsidizing the education for the physicians at that point?
We're actually pretty fortunate. We do this as a break-even event. So we cover all of our costs for the rental of the facility as well as the staffing and that. And then there's a little bit of coverage towards the CFPC overhead. So it's pretty much revenue neutral. Whatever we collect, we want to give back to the attendees in terms of delivering the event.
Okay, awesome. And then I guess what are the main sources of revenue for the event? Like there's the exhibitor fees, there's the attendee registration. Is there anything else that you guys are using as like to bolster the budget?
Those are pretty much the two big sources of revenue is registration fees and exhibitor revenue. We get a few small subsidies, or we do apply for grants whenever we can.
Okay, yep.
We'll have some grants sometimes for our simultaneous interpretation or some other things like that. But for the most part, we're trying to balance it out, get lots of exhibitors, and keep the attendee fees as low as we possibly can, but still be able to afford to put on the event.
Okay, very cool. When it comes to the content, how do you guys decide on the speakers for the presentations? You mentioned earlier the abstract call-outs go out. How do you choose the themes? How do you choose the different types of talks you want to have?
Actually, my abstract and session lead is in the audience right now. If only she could answer this. But we start working on this the previous year. So we will do a needs assessment based on our survey data from this year and look at what are the highest needs categories. What are our physicians saying they want to see more of? What do they need more education in? From there, we as the abstracts come in, so we put out the call looking for these high needs topics. They'll be reviewed by at least 3 reviewers and scored. Once they're all scored, we get together for 2 full days in March to evaluate everything. And we sort of start at those highest needs categories and pick the absolute best scoring from those needs categories. So we're trying to cover typically 50 to 60 topics or subdomains within the stream of family medicine, starting with kind of giving the most space and awareness to the most important topics that are facing our family doctors right now.
Very cool. Okay, so it is really driven from the bottom up by demand for the different parts of the education.
Exactly.
Okay.
Exactly. Yeah.
Do they get paid?
No, they do not, but they do get to come to FMF and don't have to pay their registration fee, and we nicely give them a hotel room to stay in.
Okay, all right, that's a pretty good deal then. Right
So
on.
there is a little perk to being part of the committee, but we do expect there's quite a bit of work to do throughout the year to help us plan it. So
How often does somebody not show up, like one of the key speakers or the educators?
Fortunately, that doesn't happen too often, but if it does with us having concurrent sessions, we can cancel a session if needed. And a lot of times the presenters have co-presenters that can potentially take over for them if they need it.
Oh, gotcha. Okay, so there's some redundancy there. You could shuffle people around.
Yeah, totally.
Does the keynote speaker ever accidentally bail or get stuck on the tarmac?
that would be terrible. But
Hopefully not very often.
knock on wood, that hasn't happened to me in the last 10 years here, but certainly we do have a few really great speakers, even on staff. I mean, our CEO right now, Dr. Mike Allen, is one of our most popular speakers every year, so I'd probably beg and plead for him to get up there and host a keynote for me.
You'd probably be able to come up with something on
Exactly.
the spot, no problem.
Exactly.
Awesome. The accreditation for the talks, how many hoops do you actually have to jump through? I've heard this is quite the process.
Yeah, this is a tough one. Cheryl, our FMF manager, she tackles this one. But we just start at the beginning by making sure that we are adhering or exceeding all of the main parole requirements throughout the entire planning process. And then when it comes to the actual paperwork, I'm going to say it takes us 2 or 3 months. Even though it is internal, the CFPC does certify the Family Medicine Forum. We go through the exact same accreditation process as every other event or group that wants to put on a session. So we definitely have to, keep our work very organized to make sure we can get this certified on time.
Yeah, they're not taking it easy on you.
No.
Well, that's awesome, though. I guess that makes a lot of sense, right? They're sort of like the big reputable organization in Canada when it comes to education. You got to make sure they're setting the bar high.
That's right. If they tell us we need ethics review, we're doing ethics review. Every single person on our committee also has to declare all their conflicts of interest, sign different paperwork, make sure they attest that what they say and believe to be true is true.
How often does a talk actually get denied then based on the abstract that they put forth and it sounds good, but then it doesn't pass the accreditation?
It happens a fair bit. We do try to catch it early on in the process. So I think there's about 15 questions related to conflicts of interest, related to who created the content. The entire conference is based on peer-to-peer, evidence-based, research-based education. So if the committee doesn't feel that they're meeting those criteria, we're better to deal with that up front, or we have an entire sort of mitigation policy and strategy that someone from our committee will have a discussion with them. We'll make sure it is going to meet and exceed those standards. And if there is anything questionable in it, we always put auditors in the room as well to evaluate how did it actually do? Did we make the right decision?
Okay, awesome. And then what about for the exhibitors? Are there any rules on like who can or cannot attend?
We do have some categories that we do not allow. So it does have to be, it is a marketplace. So we promote it as a marketplace. So it is, people understand that they're coming in here as a marketing area, but we don't allow medicinal marijuana. We don't allow homeopathic products. We don't allow anything sort of on the fringes. I guess I would say that it's more truly support for family doctors, products family doctors would use, things family doctors would prescribe. So sort of directly related to how they support their patients or their work managing their office.
Okay. And then I was bummed out not to see it this year, but the giant colon exhibit from previous years. What was the coolest exhibit you guys have ever seen come through, I guess, over the many years you've been doing this?
Yeah, the giant colon's a fun one. Everybody loves that.
The polyps dangling from the ceiling and everything.
I know. It's great. I haven't actually seen another giant exhibit like that before. But Cheryl, our FMF manager, she brought up many years ago that the Canadian Armed Forces actually brought in a field hospital, and it took up a big portion of the exhibit hall. So that's one that she'll never forget and loves talking about.
They set the whole thing up like just like a real one.
Yeah,
Wow.
yeah, pretty neat.
It had been to Afghanistan.
Yeah, that
Okay,
had
battle
been-
tested
Yeah,
and everything.
yeah.
Tell me about the food. Like when it comes to feeding this many people, how does that typically work, and how do you choose what you're going to do?
This is a very long process. We work on this for about 6 to 8 months. So everything from the start where we're collecting all the dietary restrictions, we're meeting with the chefs, discussing what are the best possible options to feed, say, 1,500 people at breakfast or whatever. So we're looking for the best solutions that are both sort of, we want healthy choices, a variety of choices. We want to be able to meet all of the dietary requirements. So we plan this for many, many months to try to get it as best as we possibly can to make everybody happy.
The yogurt parfaits for breakfast this year were definitely a hit.
I finally tried one today. Those were amazing. And sometimes you never know. Like, it sounds really great on paper, and then you're like, oh, that did not turn out like I thought. And then sometimes something will really surprise you that is like, wow, that's amazing.
Is there like a giant kitchen in the back, or do catering companies bring everything in day out?
Yeah, no, all of the convention centers have their own like exclusive in-house catering kitchens. So it is all done through them. You're actually not allowed to bring in any outside food. So we have to order everything through the convention center. So we just work with their chefs to try to find the best possible options for such a huge and diverse group.
What does one meal for a couple thousand people cost? Like, what's the budget for breakfast, for example?
It's it's really, really expensive. It can be easily $50 a person for breakfast.
How many thousand gallons of coffee do you go through?
It is a lot of coffee. I've done some calculations on the coffee, and we can spend easily over $150,000 to $250,000 on coffee.
Holy.
But this is the thing that keeps everybody going. It's the thing that's most upsetting if it's missing, if there's no coffee. So we kind of consider it an essential item that we absolutely have to have.
That is wild. How do you guys stay on top of like just current events and trends in the conference world? Like, do you guys attend other events? Are you researching these things online, or how do you keep it fresh and exciting every year?
Yeah, any chance we get to go to another medical event to see what's up and coming and new, or any real other event, we're happy to attend and check it out, see what we can bring to make FMF even better.
So what's the latest and greatest? Like, what's going to be coming out for 2025 or 2030?
I don't know on that one.
For this year, I mean, a couple things that inspired me this year were we did a physician wellness retreat, which was really incredible and brought this amazing energy of people not only who are looking for more wellness for themselves, but also looking to share this knowledge, whether they're an academic or just at a clinic. So we're trying to bring in a couple of wellness aspects here. We had the hero dogs. We had a program with Destination Vancouver where you could go see different attractions in the city while you're here, get out and enjoy the nature. So that was one thing. Another area that I'd seen at a few different events is people had like these attendee lounges that catered to like a neurodiversity aspect. Like if you need to get away from these big crowds and have a little break, we have a room on the second floor. We just play Zen music. We have a few little fidget toys. You can just chill in there and relax and just kind of get out of the crowd. So those were two kind of, I guess, call them trends in the events industry that we tried to bring into FMF, but we're always looking to expand on that.
What are the chances of having a full petting zoo in the coming years here? Because I think the therapy dogs definitely are a hit. Yeah, like some goats or maybe a couple of ducks. Can we do that?
That would be amazing. I don't know. These convention centers have quite a few rules.
Yes.
Maybe barn animals near the food is not a good idea.
Lots of areas might be a problem.
Yeah.
Can't control those very well.
I've spent far too much time this year playing the hockey foosball game there.
Yeah.
It's been distracting me
The
from our
bubble
booth.
hockey. It's fantastic.
Oh yeah, that's a fun one.
Yeah.
What kind of feedback do you guys get from attendees? How does that typically go? What have you been hearing from previous years that you've started looking at for current year?
Go ahead.
I mean, it's always a mix. Obviously, we love to hear positive things or cool ideas that we can try. Unfortunately, sometimes we just get complaints about the coffee.
It's not enough.
It's just never enough coffee, no matter where how much coffee you have. It's just never enough. But no, we haven't, it'll be a bit. This is part of that couple of months of analysis after the fact, but we will coordinate all of that feedback. And every year we find definitely some aspects in there that we can use to build better and better conference every year. We're always looking at how do we improve, and there's always little things you improve every year to make it a bit better.
We'll have to have Starbucks sponsoring a booth, or perhaps just a dish of caffeine pills that people can grab on their way in.
We know you like your coffee, Jordan.
Chocolate covered espresso beans.
Well, I'm glad it went well. Walk me through, what is a day like for you two while the event is actually going? You've just spent a year and a half or 2 years preparing for it. What do you actually have to do day of as the event is going on?
Yeah, I know. Obviously, we really want everything to be perfect because we do put a lot of our efforts into this planning all year. So during the day, it is essentially we have 4,000 people here, 600 exhibitors, 300 speakers, and an entire team of vendors supporting us, hundreds of people working in the convention center, along with our decorators, electrical, all of this. So it's just essentially keeping everything running. Vendors have questions, our exhibitors, our attendees. We have people stationed to support everything from the reg desk to the session scanning to things with the app, different things happening with the live stream. We had a couple of media people coming in today, supporting all of that. Our dogs need rest areas,
Yes.
It's a never ending, just supporting and helping to make sure everybody has what they need.
Awesome. And then what are you the most proud of this year?
I think it's never just one thing. For me, it starts with scratches of paper, when you're starting to plan at the beginning in December for the next year. So, and then seeing it all come to fruition and being able to provide the venue for the exhibitors and sponsors to make a difference in our family medicine that we need here in Canada.
Awesome. Well, thank you so much for hosting everything. It's been an amazing week so far. I've eaten way too much candy. It has been a lot of fun. And yeah, thank you, I guess, just for organizing everything. It's been a good week.
Thanks so much, Jordan.
Thank you. That was fun.
Thank you for joining us this week on Leaders in Healthcare. If you enjoyed this episode, please like, subscribe, or leave a comment. And if you found this episode helpful, don't forget to share it with your network.